Hi everyone and welcome to the Helper Medic. Today we're going to be talking about how to create a clinical approach. So in the next few weeks I'm going to be uploading a few approaches to common symptoms such as dyspnea, chest pain, weakness, etc. But today I wanted to go through how you actually craft an approach because it's a skill most doctors and students are going to need. And if you have the skill to make an approach, you can make an approach to pretty much any topic as long as you have enough information and you take your time. What is an approach though? Why do you need it? If someone asks you for the causes of a specific symptom or sign, you could just go, well, I know this cause, that cause, that cause, that cause, and rattle them off like that. But chances are you'd miss at least one or two, and probably more than that. So that's why we have approaches. An approach is a system of classifying and organizing the causes of a specific sign or symptom in order to make sure that you don't miss them if someone presents with that. It's a way of organizing your thinking to make sure you don't actually miss important causes if your patient presents with it, just because you couldn't think of them. Now, each approach is slightly different, has subtle differences in the way you classify things, but the general steps are the same. And today we're going to go through the general steps that you take when you're organizing your thoughts and creating an approach for any symptom or sign. As always, if you like the video, make sure to subscribe to the channel for more content like this, and don't forget our ECG series that's still ongoing. Like the video, leave a comment, and if you want access to the PDF notes that I make while I'm doing these videos and live monthly tutorials with me, consider supporting the channel via the Patreon. The link is in the description. Now let's get to our actual approach. For this how-to video, we're going to be discussing the symptom leg pain, just so you can get a feel for how to actually craft your approach. Now, you start with your symptom, right? Always start with your symptom. And then the first way you split it is you split it into causes. And the way I like to do it is I like to start with acute and chronic, right? Because a lot of different symptoms have different causes depending on the time frame. An acute cause is not going to be the same as a chronic cause of leg pain. Right? Now, there are some causes that will be the same between acute and chronic, but that's fine. You just list them for both. Right? And once you've got acute and chronic both on your mind map, then you consider each one separately. So we're going to start with the acute causes. Once you've split it into acute and chronic, I find the best way is to then proceed anatomically. So go by organ system that could be involved. So if you're looking at a sore leg, the organ systems that would be involved are musculoskeletal. Then there is neurological, vascular, and don't forget soft tissue, right? Because all of these could actually cause leg pain. Now, you can write it out, you can draw pictures, you can do whatever you want here. I mean, the approach is for you, so do what you're going to remember best. What you do now is you differentiate each system further down into other causes. So you take musculoskeletal and you can divide that up further, right? So you can divide it into muscle, and again, I'm just going to draw because it's easier to do on here. So muscle, bone, and then joints, right? Those are the three subsystems that are involved here. And now you can say, let's differentiate further. Let's go into muscular causes. So muscular, you can differentiate into unilateral causes and bilateral causes. And then you look at, let's say, unilateral causes. What are unilateral causes of leg pain that only affect the muscles? So you could have strains, you could have trauma, anything like that. Now you've differentiated far enough, because now you're down to unilateral causes of muscular trauma, which would cause leg pain. That's differentiated enough. Once you're done with that, you go to bilateral causes, and then once you're done with that, you go to the skeletal system and you do pretty much the same thing. Same thing with the joints. You can look at one joint, multiple joints, all the joints, and you go through each subsystem like that. Once you're done with that, you do the same thing to neuro, you do the same thing with vascular, same thing with soft tissue. And once you're done with that, you're finished with the acute side. Then you move on, you do the same thing on the chronic side. Honestly, once you have some experience in how to craft an approach and how to read an approach, it's one of the most useful learning tools that you have. Either crafting your own, looking at someone else's, studying approaches, it's one of the best learning tools you have as a medical student. And I think one of the biggest failings people have when they're crafting their approaches is they don't use the anatomy effectively. So they don't actually say, okay, how can I use what's going on there to guide my approach? And so they end up missing things. Yes, there are some symptoms that don't correlate well with anatomy, right? But yeah, most symptoms will correlate really well with anatomy. So make sure when you're doing your approaches that you look at the anatomy and you say, how can this help me craft an approach? And that's it for how to craft an approach. Make sure you check back for more approaches that I'll be doing in the next few weeks, and don't miss the weekly updates to our How to Interpret a 12-Lead ECG series. Thanks everyone for watching. I'll see you all next time.